Hello, welcome. This is the first edition of 321 Kent County's new venture called Talk of the Town. I'm Johnny Boots. Welcome to this. This is going to be something different. This is going to be something new. Myself, John Parenti, will be doing various interviews of civic leaders, politicians, and just whoever's making news in the Kent County area. But nothing will be controversial. Nothing political, nothing controversial. Everything's going to be good. We just want to look at the great aspects and what people are doing in and around Kent County. So, without further ado, let's get on with the show. My first guest is Ryan Simcoe, West Warwick firefighter and lieutenant, but also, and I'm going to have him explain it, is what, besides being a lieutenant on the trucks, what do you do? I wanted to introduce people to paramedicine.
Yeah.
What is it?
So paramedicine is a new response model for EMS. Instead of waiting for emergencies to come in, we proactively seek patients that utilize the 911 system higher than most, and we try to proactively keep them out of the hospital. Think of it as EMS prevention rather than fire prevention.
That's different.
Yeah.
Where did the program get started?
In 2022, we received a grant originally from COVID. We were trying to keep as many patients out of the hospital as possible just because the hospitals were overrun. But it sort of transitioned once COVID calmed down. We sort of transitioned to more chronic disease, high blood pressure, COPD, CHF, diabetes, things of those nature, and so a huge benefit in seeing these patients and keeping them out of the hospital whenever possible.
Going forward, how did you transition and how did you get these patients' names? Did they come from doctors, hospitals? Did they sign up?
Yeah, so we have a couple different avenues of receiving referrals for patients. The biggest referrals we get are from our EMS providers, the guys on the front line seeing these patients. So if they identify any type of need for a family or the patient, they'll refer the patient to our program. Also through our computer system, we're able to track how many times each patient goes to the hospital monthly. So when we see patients utilizing 911 and going to the hospital at a higher rate, we'll outreach those patients and set up a visit. And then another way, we also receive referrals from our primary care provider partners and Kent County Hospital as well. So any patients that are at high risk of returning to the hospital will send us a referral to follow up with those patients. And then any patients that are homebound, their primary cares can reach out to us as well to provide care in the home.
So a couple of questions come from your answer there that kind of triggered in my mind. First and foremost, let's just ask, can people sign up for this program without having to go through any of those avenues?
Yeah, so within our community paramedicine program, we have multiple sub-programs. So we have a program called Community Outreach. So elderly patients in the community that just want monthly check-ins, we can set up monthly visits with them just to check their vital signs, do a physical assessment, and make sure their chronic conditions are managed appropriately. If we identify any issues, we reach out to their primary care to change their care plan and see what we can do to improve their quality of life.
You said it was a grant back in 2022.
Yes.
And I remember you guys getting that grant and talking to a few of you about it. It's 2026 now.
Yes.
How are we doing with the grant? And if there is no grant, do people pay for this? Does it home care, Medicare, Medicaid? How does that work?
So right now, the original grant ran out last year. We've applied for several other grants that we received. We received a grant from the Alzheimer's Association, so we also partner with them, and that's another program that we work with. So patients in the community that have Alzheimer's or dementia, we'll do monthly check-ins with them as well, try to assist the family with sending referrals out to see if they need any more assistance within the home, and then we'll follow them medically as well, just because a lot of times patients with Alzheimer's or dementia, it's hard for them to portray to the family, what their medical complaints are, and they could be vague. So it sets the family at ease, when we are able to go in and give them some advice. So we received a grant from them that's helping us sustain, and then we also received a grant from the governor's office through a community block grant that we'll be operating off of through the next year. As far as billing goes, insurance does not reimburse for any of these services, private or Medicare or Medicaid. We're working with legislation this year. Hopefully this is the year that it goes through. But there are a couple bills up at the State House that would allow us to be reimbursed through insurance for these services. And then there's also some federal legislation as well that's on the table this year. So fingers crossed.
I'm going to put you on the spot and embarrass you because
right.
I've known you a long time. I follow this program through different avenues, and last year you were given an award. You're like the guy to go. You're like the go-to guy in the state that's written pretty much the plan for this paramedicine program. So I'm going to put you on the spot. How did you get so deeply involved with it? I know I heard about when I was leaving, retiring, and then it just exploded, and they said Ryan Simcoe ran with it. So I'm not just going to put you on the spot for being, an advocate for it, but how did you get so involved, and where did you go to learn about paramedicine, to take it to that next level and get other communities involved? And do you know of any other communities that are involved?
Yeah, there are quite a few communities in the state of Rhode Island that are involved. We'll get to that in a second. But originally, when COVID hit, I was in charge of the Meds Pod program, doing the vaccination clinics, and I was heavily involved with, trying to keep patients out of the hospital as much as possible with COVID through the vaccination efforts. And then this grant came about, and I was sort of thrown into that role just because of what we were already working on, and that sort of just transitioned to this whole community paramedicine model once COVID sort of calmed down a little bit, and we had that grant funding that we sort of had to switch gears with. I've been extremely passionate about trying to get patients the right care at the right time for a long time. We see patients over and over again that are transported to the hospital, and nothing really changes the cycle of them being transported. So being able to be on the front lines of something new and innovative with breaking that cycle and treating patients in the home where it's a better fit for them rather than being transported to the hospital and having the highest cost associated with that. So I am extremely passionate about changing the EMS model, and treating patients at the right time at the right place, and it's cost effective. And there are other communities doing it, and I can't take all the credit we work collaboratively. When we first got the grant, Smithfield Fire, Narragansett Fire, they worked alongside us to develop the protocols and the guidelines to see these patients as well.
So people are going to be welcoming you guys into the homes, other than being an EMT cardiac, advanced, paramedic, what other training do these guys have going in? Because I know you guys, I've heard of you guys going to trainings and things like that, guys being registered or certified. What does that entail?
Yeah, so we developed a 20-hour training program that sort of covers what the EMT and paramedic classes don't. We're well versed on treating patients. It's more of the social aspect of things that isn't covered in your EMT or paramedic course. So with healthcare now, you'll hear social determinants of health thrown out there a lot. It's really what goes into the patient's health outside of that direct treatment. So, access to primary care. Do they have a lack of transportation? Do they have a family support system? Finances? Looking at the patient as a whole rather than just, all right, we're going to provide this treatment. So training our members and looking for those, social aspects of the patient as a whole, that's really what we covered rather than your EMT or paramedic program.
I know we talked, when I started the show, I said we're not going to talk politics, but I just want to touch a little bit upon the legislation that's at the State House, and we'll keep it at the local level.
Yeah.
Our State House, what legislation are you and the advocates going for with this paramedicine program? And what can people do? What can constituents do to kind of push this along? Yeah,
so what we're asking for is for private and Medicare to cover the cost of the visits themselves through insurance reimbursement, and that would allow us to sustain these programs, because right now without reimbursement, there's no sustainability. So we're asking for them to reimburse us for the community paramedicine visits, and then also EMS countrywide essentially only gets reimbursed through insurance if we take someone to the hospital.
Yep.
So if we provide care and treatment on scene and we don't transport the person, we receive zero reimbursement.
Basically,
from
like a
insurance.
paramedicine visit.
Correct, yes. So what we're asking for as well is if we provide treatment on scene through 911 calls as well, that insurance reimburses us for the care that we're already providing. And that's saving everybody money, the patient, the healthcare system as a whole, and the insurance companies as well. We're asking for a very small amount for these visits,
Sure.
whereas the average cost for someone to go to the hospital in Rhode Island is $1,700 that insurance is paying out. So to be able to pay for these visits and keep someone in the home, the cost is minimal.
Okay, so let's talk about a little bit about. I want to talk a little bit about the paramedicine program. How many people, off the top of your head, and I know I hear it on the scanner. I hear you guys, paramedicines out there, Paramed 1 or Medic 1 or whatever you guys call it yourselves. And, how many people are out there? How many people are you servicing in just the West Warwick area?
Yeah, so we've, in the last couple of years, we've serviced over 200 residents throughout the program, and we're averaging around 600, 650 visits a year. Yeah.
I didn't realize that.
Yeah, it's quite a bit.
Wow.
And it's been very positive. The feedback from patients has been positive. They're happy with the program. They love not having to go to the hospital.
sure.
They'd rather stay in their own home.
Yep.
And as far as we have a program for our high utilizers. So, if you looked at our top 25 patients that call 911, that accounts for almost 15% of our call volume, which is quite a bit.
That's quite a bit.
With the patients that we enrolled into that program, 6 months post-graduation, we have nearly a 90% reduction in 911 transports for those patients.
That's huge.
It's huge.
Knowing the
Yes.
numbers, that's huge. That's
Yes. Yeah.
big.
Yeah.
Wow.
And to put into perspective, we looked at 6 months worth of data for just those patients alone that we graduated, and it was a cost savings of almost over $300,000 to the town of West Warwick.
Wow.
Because when we transport someone to the hospital, insurance reimbursement doesn't
I know
cover
it's
the
very
cost.
it's nil. It's very small.
If it costs us around $1,800 for a transport, we're only receiving $350 reimbursement. So every transport we lose money on. It's not a money maker. So to be able to divert those patients from the hospital, it's a cost savings to the taxpayer.
How receptive are the constituents or the townspeople to this program? Do you get any pushback?
We have not received any pushback.
That's good. No, I just
No.
wonder. You never know. You never
Yeah.
know.
Yep.
Even when we come in as EMTs and go into somebody's house, they don't want treatment. They don't want us there. I was just wondering if you had any pushback. So I'm listening a lot, and you know what I do for a living now. But I hear a lot that Rescue 1's going on a call and paramedicine 1's following. What does that? And I don't know. What does that entail? Why is the paramedicine going with the rescue? What is that? Is there a flag in the system?
Yeah, so we know if we've identified a patient as either a high utilizer or someone that we're trying to schedule visits with, we will have Med 1 respond with the engine and the rescue, and they will sort of respond to the scene and see what social needs that family or the patient need, and try to identify why they're frequently going to the hospital. Or if it's a patient that we already have enrolled in our program, it's flagged in the system as one of our patients, and we'll try to, if the patient called 911 for whatever reason, we'll have Med 1 go as well to see if we could try to keep them in the home rather than having to transport.
How many EMTs do you have enrolled in the system as part of the program?
We have about 18 members that are trained to provide the community paramedicine visits.
How can we get the word out? I mean, other than we're gonna put this on social media, we're gonna get it out there. We're gonna see if your guys can put it on your Facebook page, and I'll see if the town can put it on there, just so we can get. What can we do? What can we tell people? Like, if I have an elderly friend or mother or grandmother that wants to get involved, how can we get that out there to them?
Yeah.
Do we call you? Do we call the
so
department?
I can give you our phone number.
Sure, we'll post it up
Yeah.
we'll have it posted on here.
Right. Or we also have an email address that they can email our program as well to set up a visit with their, the patient or the family can set up a visit as well.
How confident are you with the future of paramedicine, not just in West Warwick, because I know that's something near and dear to your heart, and I know Chief Ferrone and Chief Norberg, that's near to their heart too, because they're very community oriented. But what do you think the future is of paramedicine?
I think it's the future of EMS, to be honest. I think with the way healthcare is right now and the sustainability of healthcare, that it costs a lot to provide care and the money's not out there, for anybody, even the hospital system. And a lot of these hospitals are looking into programs such as community paramedicine to reduce overall costs. And there's even Rhode Island Hospital has a community paramedicine program as well, and they're doing it. They're not getting reimbursed as either, but they're seeing the cost savings by providing these services. So even though there's no reimbursement, there is cost savings out there, and people are recognizing it.
Cheaper to send a paramedicine guy out than it is to get transported to a hospital
and be admitted
for a couple of days, and
Yes.
that could have been preventable and,
Yep.
and savings money on the patient's end. And if the patient can't pay, obviously it's savings on the hospital end.
Correct.
Yeah, I gotcha. So going forward, is it a full-time position?
It is not. Right now, we rotate members through based on their days off. So they'll ride the engine or the rescue on their regular shift, and then on their days off, they can pick up shifts on Med 1, which is our community paramedic truck.
Do you think this could be a full-time position?
Yes, absolutely. We're doing about 650 visits a year, and we could definitely expand that if we had the funding to increase
It's like
hours.
2.5 a day.
Yeah.
Plus the
more than
ones
that.
more than that,
Yeah.
but yeah, if you take the weekends out, because you guys aren't
Yeah.
on the weekends. But
Yeah,
then
so right now we operate 9 to 3, Monday through Friday. So if we're able to expand those hours, we'd be able to definitely see more patients.
that's excellent. That's just you've educated me. I knew a little bit about it, but I just got educated a lot more.
Yeah, and in 650 is a good number, but not even just looking at the response numbers, we have to look at how long we're spending with those patients. So typically on a 911 response, we're spending about 15 minutes on scene.
Yep.
For our community paramedicine visits, we spend 45 minutes to an hour with the patient. So you get a good chunk of time, learning about the patient, really finding out what their medical needs are, especially when you go to a doctor's office, where there's a lack of primary care. They have a ton of patients to see. You're spending about 15 minutes with
I was just going to say that. Patients are spending more time with the paramedicine guy than they have their doctor.
To really sit down and learn about the patient and their health, and it makes a huge difference.
Oh, thank you. That's huge.
Yeah.
That's in itself looks like it could be a benefit for the patient.
Yes.
And then
Yep.
if you take that information and pass it along to their PCP, their primary care,
Yeah.
that's work they don't have to do and things they probably never even ventured into looking into.
Yeah.
That's excellent, excellent. Well, Ryan, thank you so much. I got to ask you a question, and I'll say this because this is taped, obviously, and it's the day after the Super Bowl, and you can touch upon it quickly, but I just want to, you guys had a big fire last night, 3-alarm fire in West Warwick. Nobody got hurt, from what I hear, but I just want to do a shout out, and I wanted to confirm with you when you came in that AJ's Restaurant, a sponsor of 321, Arthur Brown and his staff opened up the restaurant last night. I was made aware of it like at 6:30, 7 o'clock maybe, that Arthur Brown opened up the restaurant to the firefighters.
Yep.
Because there was a lot of firefighters on scene to open up to let them warm up and get some hot coffee and cocoa and something to eat. So we want to shout out to Arthur Brown. Thank you to the Arthur Brown and his staff for opening up AJ's the day after the night of the Super Bowl during a 3-alarm fire in West Warwick. So, Ryan, thank you. I'm going to touch base with you again. Maybe 6 months we could talk about it again, see where the program is. You keep me posted about the legislation because I'd really like to report on that and bring it back to the people. But thank you so much for coming over today and spending some time with us. I appreciate it. Thank you.
Thanks for having me.
So, until the next time, and Talk of the Town, it's John Patello saying stay well, stay safe.